I truly understand the worry and curiosity you must feel as you delve deeper into a rare condition like fatal insomnia. Also known as fatal insomnia, it's a truly heartbreaking situation. A rare neurodegenerative prion disease that turns sleep, something we often take for granted, into an insurmountable challenge. Marked by increasingly severe sleep disturbances that ultimately lead to death, it's nothing like the common insomnia we might fix with a change in habits or a familiar sleeping pill. Instead, fatal insomnia is a painful journey, driven by the buildup of abnormal prion proteins in the brain, causing deep damage to the thalamus, the vital center regulating our sleep-wake cycles and alertness. It's so sad to realize this illness comes in two main forms: fatal familial insomnia, or FFI, a genetic type caused by a mutation in the PRNP gene on chromosome 20, and sporadic fatal insomnia, or SFI, a spontaneous form without a specific genetic mutation. Regardless of the type, the outcome is unavoidable. Sufferers lose the ability to sleep entirely, falling into physical and mental exhaustion, and pass away within months to a few years. As of September 20th, 2022, only 70 families worldwide are known to carry the FFI gene, with 37 SFI cases diagnosed, a tiny yet haunting number, marking it as one of medicine's rarest mysteries. What are your sleep problems? Comment below to share your struggles, and I will make a video for you. Don't forget to subscribe and turn on notifications for more great sleep videos. Symptoms and the challenging journey through stages. When I think about fatal insomnia, it's hard not to feel compassion for those who endure it. This illness unfolds a series of symptoms, starting with sleep disruption, progressing through 4 distinct stages, each lasting a few months and growing more burdensome. In the first stage, lasting about 4 months, patients begin struggling to fall asleep or stay asleep through the night. It's not just a simple sleepless night. It comes with painful psychological reactions like panic, anxiety, and phobias. Perhaps you've stayed up late and felt uneasy before, but for them, this unease becomes inescapable. They might jolt awake from nameless fears like claustrophobia or a fear of heights without knowing why. These issues don't just interrupt sleep. They destabilize their minds, deeply affecting daily life and making them feel trapped in their own bodies. Moving into the second stage, lasting about 5 months, things get heavier as mental symptoms become pronounced with the onset of hallucinations and increasingly severe panic attacks. Imagine glimpsing a shadowy figure in the corner of your room or hearing whispers with no source. That's terrifying, isn't it? For patients, these hallucinations are more than illusions. They heighten stress and exhaustion, plunging them into constant anxiety. At this point, they become hypersensitive to their surroundings, easily agitated, and struggle to control their emotions. Loved ones, family, and friends might notice a stark change, from a cheerful person to someone irritable, frightened, and sometimes unaware of reality. It's heartbreaking to witness. By the third stage, lasting about 3 months, patients fall into total insomnia, a condition called agrypnia excitata. Just picture it. Not sleeping a single minute, no matter how exhausted their body becomes, that's a pain hard to imagine. Prolonged sleeplessness leads to rapid weight loss as the body lacks rest and metabolism goes haywire. They might drop dozens of kilograms in weeks, becoming frail, weak, and prone to infections. This physical decline doesn't just harm their body, it worsens mental issues, leaving them nearly unable to function. Families might only hold them close, powerless as their health fades. Finally, in the fourth stage, lasting about 6 months, patients enter dementia. They stop responding to the world around them, unable to speak, often slipping into silence or unconsciousness. This is the final phase where body and mind are fully destroyed by prion buildup and relentless sleep deprivation. Death typically follows, with the total duration from onset to passing ranging from 6 to 36 months, averaging 18 months. This journey is a battle for the patient and a profound sorrow for families who watch their loved ones waste away with no way to help. It's incredibly hard to accept. Beyond insomnia, fatal. Insomnia brings other widespread symptoms affecting both body and mind. Ataxia or movement disorders makes it hard for patients to control their actions. They might stumble, tremble, or struggle to walk normally, which is truly pitiful. Many, especially with SFI, experience double vision, complicating their ability to see the world clearly. Dysautonomia, issues like excessive sweating, high blood pressure, rapid heart rate, and pinpoint pupils, or meiosis emerge as if their body betrays them. Other signs include neck stiffness, prolonged constipation, and in women, sudden early menopause, or in men, impotence. These make life even harsher. Notably, a prolonged hypnagogic state, a limbo between wakefulness and sleep, normally brief in healthy people, becomes a burden. In this state, patients move their limbs unconsciously as if dreaming, yet they can't reach deep sleep. These symptoms strip away quality of life and push them toward an unrecoverable decline. Causes and mechanisms, a cruel journey within. It's deeply saddening to learn that fatal insomnia is a prion disease caused by the accumulation of abnormal prion proteins in the brain, a cruel process we struggle to stop. The normal prion protein, or PRPC, is encoded by the PRNP gene, located on the short arm of chromosome 20 at position P13. In FFI, a rare genetic mutation at codon 178 of the PRNP gene changes aspartic acid, or D, to asparagine, or N, known as the D178N mutation. This must pair with methionine at codon 129 on the mutated allele to trigger FFI. If codon 129 has valine instead, it may lead to Creutzfeldt-Jakob disease, or CJD, another prion disorder. The SFI form lacks the D178N mutation but involves methionine homozygosity at codon 129, still causing similar prion buildup. These abnormal prions severely damage the thalamus, particularly the mediodorsal and anteroventral nuclei, key areas for regulating sleep-wake cycles. This buildup reduces glucose use in the thalamus and causes mild hypometabolism in the cingulate cortex, completely disrupting sleep ability. Studies show this metabolic decline varies. Methionine homozygotes at codon 129 often suffer more than methionine valine heterozygotes. The thalamus acts like a switch between alertness and sleep, and when damaged, the body can't rest, leading to constant wakefulness and exhaustion. This process may silently progress for years before symptoms appear, but once it starts, it advances rapidly, offering no chance of recovery. It's heartbreaking to consider what they endure. Diagnosis and differentiation. A quest for truth. I realize diagnosing fatal insomnia is a huge challenge for doctors, as early symptoms are vague and easily mistaken for other conditions. Diagnosis begins with clinical signs like progressive insomnia, movement disorders, hallucinations, and autonomic issues like high blood pressure or sweating. To assist, doctors use sleep studies to assess sleep-wake cycles, PET scans to detect reduced metabolism in the thalamus, and genetic testing if FFY is suspected. A highly sensitive test called RTQIC, real-time quaking-induced conversion, detects PRPSC in cerebrospinal fluid, or CSF, but its sensitivity is only about 50% for FFY and SFI, with ongoing improvements. PET scans with 18-FFDG show severe thalamic hypometabolism early on, spreading to the cortex, though high costs and complexity limit routine use. Definitive diagnosis requires a brain autopsy after death, revealing characteristic thalamic degeneration and prion signs. Fatal insomnia must be differentiated from diseases like Alzheimer's, frontotemporal dementia, or other prions like Creutzfeldt-Jakob disease, or CJD-Kuru, or mad cow disease, or BSE. The key difference is FFI and SFIs focus on insomnia and thalamic damage, while others cause more widespread brain injury. In SFI, insomnia isn't always the first symptom. Some start with ataxia, cognitive decline, or double vision, adding diagnostic difficulty. It's unfortunate how complex this process is. Treatment and prognosis. A fragile hope. I feel for you when I say there's currently no treatment to alter fatal insomnia's course. Care is limited to palliative measures, aiming to ease symptoms and offer some comfort. Medications like clonazepam help control seizures or involuntary movements, while azopiclone or zolpidem may aid sleep temporarily. But it's sad to note these don't work long-term, as the disease continues destroying sleep capacity. Opinions differ on sedatives like barbiturates. Some studies suggest temporary relief, but they can't halt progression. The prognosis is grim, with a 100% mortality rate. Survival from onset ranges from 7 months to 6 years, averaging 18 months. Death often follows complete dementia, with no response or communication, and a body worn out from sleep loss. This is devastating, not just for patients, but for families watching their loved ones fade without help. I hope science will one day bring hope. Epidemiology and history. A touching story. Fatal insomnia is among the rarest diseases globally, and I'm amazed to learn only 70 families carry the FFI gene and 37 SFI cases are recorded as of September 20th, 2022. These families span Germany, Italy, the US, France, Australia, the UK, Japan, Austria, and Spain's Basque region, where 16 FFI cases from 2 families trace to an 18th century ancestor. A notable case in 2011 involved a 57-year-old Egyptian man in the Netherlands who began with double vision, memory loss, and paranoia, dying after 7 months with thalamic atrophy confirmed at autopsy. First described in 1986 by Dr. Elio Lugaresi in Italy, it stemmed from Silvano, who in 1983 agreed to be filmed and donate his brain for research. The 1986 report and 1992 study identified FFI as a genetic prion disease tied to the D178N mutation. Another case in 2001 in the US saw a 52-year-old extend life nearly a year with vitamins, meditation, and sensory deprivation, writing a book and driving, yet succumbing to the disease's stages. Research and prospects. A ray of hope. Though no cure exists, I'm encouraged by scientists' efforts. Animal trials with pentosan polysulfate, mepicrine, amphotericin B, and doxycycline since 2016 offer hope, despite no human success yet. The 2009 mouse model with the D178N mutation replicates symptoms, aiding research. The Prion Alliance, founded by Eric Minikel and Sonia Volov after her mother's diagnosis, develops therapies and seeks biomarkers at the Broad Institute, targeting methionine at codon 129 as a promising approach. Meaning and message. Fatal. Insomnia gently reminds us that sleep is a precious gift. Understanding it helps us cherish peaceful rest. If you or a loved one face prolonged sleep issues, see a doctor. Sleep is our health foundation. Like, if you're ready to sleep better, subscribe and turn on notifications for more insomnia videos. Thanks, and see you in the next video.